I'm Matthew Sides, I'm the trial statistician for Radicals, and over the next couple of minutes I'm going to lead you through the design of the trial. So this is an efficiently designed trial, which is going to address two of the most important questions for men who've had a radical prostatectomy for prostate cancer, namely, the need for and the timing of post-operative radiotherapy, and the use and duration of hormone therapy with any post-operative radiotherapy given. There's currently quite a lot of variation in practice in both of these terms, and it's possible for men to join one or the other randomization as is suitable. So the first randomization and the crux of the trial is immediate radiotherapy versus early salvage radiotherapy policy question. So men for whom there's uncertainty about the need for immediate post-operative radiotherapy can be randomized to have radiotherapy immediately or to follow an early salvage radiotherapy policy. Effectively, this is an optional randomization only for patients where the need for immediate post-operative radiotherapy is uncertain. The other randomization is for men who are starting post-operative radiotherapy in either an immediate or a salvage setting, and they can be randomized to radiotherapy alone, or radiotherapy with 6 months of hormone therapy, or radiotherapy with 2 years of hormone therapy. Again, this is an optional randomization. It's also possible for men to have joined this question, having already joined the radiotherapy timing question. Men joining the hormone duration randomization may be randomized between just 2 of the arms, rather than between all 3. So there's a number of paths that men may take if they've had a radical prostatectomy, many of which will bring them through the radicals trial. The following diagrams show these paths. This looks rather complicated when we put all of the paths together, but when we break them down into simple paths, it becomes very straightforward. So we start off by assessing the needs for radical prostatectomy. Is post-operative radiotherapy required immediately? If the answer is yes, then these men can follow an immediate radiotherapy policy and may join the hormone duration randomization, where they be randomized between 2 or 3 of the hormone duration randomization's arms. They'd then be followed up for all of the trial outcome measures. If it's clear that the man doesn't need post-operative radiotherapy, then they can follow a salvage radiotherapy policy off trial, where they be monitored off trial, and should they ever have a rise in PSA and be planned for radiotherapy, then they can join the hormone duration randomization at that point, where they be randomized between the same choices of arms. And again, they'd be followed up in just the same way. For many men, the use of post-operative radiotherapy will be uncertain, and they can join the radiotherapy timing randomization, where they be randomized to immediate radiotherapy or salvage radiotherapy as a policy. If they're allocated to immediate radiotherapy, it's possible they might choose a hormone therapy and choose whether to have hormone therapy or not when being given radiotherapy. They would then be followed up for all the trial outcome measures. It's important to note that this isn't yet implemented in radicals. Alternatively, if they're allocated to immediate radiotherapy, they could join the hormone duration randomization at that point. Now, all of those men will be followed up in the same way. If they're allocated to a salvage radiotherapy policy, they'd be monitored on trial, and if there isn't a rise in PSA, then they wouldn't have radiotherapy, but they would be followed up for all of the trial outcome measures. If they do experience a rise in PSA, then they should start their post-operative radiotherapy with a choice, which could be with a choice of hormone therapy or no hormone therapy, according to the doctor and patient's choice. They start the radiotherapy, and they're followed up for all of the trial outcome measures. This choice approach here is implemented in radicals already because of a need to consent twice before any randomizations. Alternatively, if they have a rise in PSA, they may join the hormone duration randomization at that point, should it be preferred. So let's recap. If they join the hormone duration randomization, and the patient doesn't want to join the hormone, if the patient joins the radiotherapy timing randomization and doesn't join the hormone duration randomization, then the paths look this simple. Alternatively, if the clinician and patient wish to support the hormone duration randomization, the paths will look like this. So if we put this all together, these were the paths for the trial. Hopefully you'll see that the individual paths are very simple. Which patients should we be uncertain about giving immediate radiotherapy to? Well, this is up to you. The guidelines are permissive. However, these are the patients that we think you should be uncertain about. The primary outcome measure is disease-specific survival, which is the most relevant clinical outcome measure for this group of patients. The trial needs a lot of patients to join up, Overall, about 4,000 patients, maybe more, will join this study, depending on how many people join one randomization, how many people join two. So just to recap, this is a design of the Radicals trial. We look forward to hearing more from you.